Hi, this is Dr. John Henry. I'm an orthopedic surgeon with Aurora Baycare in Northeast Wisconsin, and I'd like to take a few minutes and talk to you about hip arthroscopy. Hip arthroscopy is a minimally invasive type procedure, the goal of which is to perform the same treatment that we would otherwise have to treat by an open procedure. There are certain conditions that are amenable to treatment by hip arthroscopy. These include a tear of the labrum, and the labrum is a fibrocartilage bumper pad that goes around the socket joint. Sometimes in traumatic conditions, other times from a wear and tear type process, that labrum can become torn and cause problems inside the hip joint, usually with pain felt in the groin region or the thigh region, oftentimes with catching or locking or true mechanical type symptoms. That's the most common type of disorder that I would treat by hip arthroscopy procedure. Other disorders that we often recommend hip arthroscopy for include symptomatic cartilage tears in the hip joint, either those that are occurring on the surface of the ball or the socket. These cartilage tears, when they occur, usually from a traumatic injury, sometimes from more of a wear and tear type process, can cause symptoms similar to a labral tear, pain in the groin region, catching, locking, and those can be treated by relatively straightforward minimally invasive hip arthroscopy procedure. Other conditions less commonly taken care of by hip arthroscopy include tears of a ligament that goes between the ball and the socket, sometimes from a traumatic condition, or if someone has had an episode where they've had enough injury to the hip to cause the ball to separate from the socket, that ligament can tear and cause problems. That's amenable to an arthroscopic procedure. Sometimes there are certain conditions involving the capsule around the hip joint that causes the joint to produce a lot of inflammation, sometimes small cartilage fragments that can irritate the joint. That's something that we can also clean up by an arthroscopic type procedure. It's important to note that hip arthroscopy is not a treatment or by any means a cure for hip arthritis. And there are different types of arthritis that can affect a joint like the hip, the most common being osteoarthritis or degenerative joint disease. The other one, less common, is rheumatoid arthritis, which is an inflammatory type of arthritis condition. Hip arthroscopy is not indicated for arthritis conditions, but rather for the conditions that I previously mentioned here. The other type of condition where hip arthroscopy is gaining a greater role is to treat something called femoral acetabular impingement. Now let me explain the anatomy here a little bit. And if I can show you on this model of the hip joint, there are actually two different important compartments in the hip. The central compartment is the space between the ball and the socket, as I've alluded to. And in that space, that's where you can have the conditions that I've mentioned, like a labral tear or a tear of the articular cartilage that lines the ball or the socket, a tear of a ligament that goes between the ball and the socket, a synovial or capsular condition. That's the central compartment. That's the space that we initially examine when we do a hip arthroscopy procedure. The other important compartment of the hip joint is called the peripheral compartment, and that's here, still within the capsule that surrounds the joint, but outside of the ball and socket joint. And sometimes people can develop a bone spur or have a bony prominence that can arise from the femoral neck, the space that connects the ball to the femoral shaft. And that bone spur in certain positions, most commonly with hip bending and rotation, for example, getting out of a chair or getting into a car or perhaps getting off the toilet, in those positions that spur on the femoral neck can impinge upon the socket and cause a painful condition. There's another sort of femoral acetabular impingement that can occur from a bone spur not on the femoral neck but rather from the acetabulum or the socket. And if there's a bony prominence on the front of the socket here, with that same type of position or motion of the hip, there can again be this impingement process or this pinching between the ball and the socket, causing a painful condition. That's something that we can also treat by hip arthroscopy. By putting the scope outside of the central compartment and into the peripheral compartment, we can identify that spur, whether it's on the femoral neck or the acetabulum, and use a bird type device to remove it and therefore eliminate that impinging process. Hip arthroscopy has gained a greater role and importance in treating these types of conditions that I've mentioned. The surgical technique and the instruments have greatly improved over the last few years to make this process more reproducible and safe for our patients. The results of this procedure are generally very favorable for the conditions that I've talked about here today. If someone's having pain in the groin or upper thigh region, or mechanical symptoms such as catching or locking or giving way sensations of the hip, this is likely related to one of the conditions that we've talked about, and therefore it may be a condition that can be successfully treated by hip arthroscopy. Again, it's important to understand that this procedure is not indicated or is not a cure for degenerative joint disease or osteoarthritis or even rheumatoid arthritis. You may be experiencing one of these conditions that I've talked about and therefore may be a candidate for hip arthroscopy. If you would like more information regarding this, you can contact my office and our staff would be happy to help you make an appointment.